Good morning. All right, so who here has heard me speak before? Okay, feel free to use your cell phones. My name is Stewart Perry. I'm here today to talk about health insurance. I know that's probably the most riveting thing that you've ever had anybody come in to talk to you about. This is the slide they told me I had to put in here for my bona fides. I am an insurance agent. I've been an insurance agent for almost 40 years. So let's get right into it. Today's messages. Never enroll in a high deductible health plan. How many of you all are still on your parents' insurance? Most of you. How many are thinking about what happens when you go off your parents' insurance? Never enroll in a high deductible health plan. Diabetes is expensive and is near impossible to afford without health insurance. Do the math. Not my best subject, but do the math. I flunked 5th grade, 7th grade, and 9th grade math. Don't even talk to me about trigonometry. I still don't understand it. Preparation and action are the keys to meeting these challenges. And advocate for yourself and others. So today we have 4 E's we're going to talk about in this presentation. Entertain, educate, empower, and enlist. This is the agenda for the presentation, and I won't read this because I'm sure that if you're in college, you're perfectly capable of reading. So let's talk about the first thing, which is us and them. Us being people with diabetes. Them being everybody else, okay? Anybody ever heard the term knowledge is power? So there's 2 ways of learning something. Knowledge you absorb, and information is pushed to you. Which one do you think that you retain more? The knowledge you absorb, right? That's what you're going to say, Corey, right? So why the exercise? Health insurance is like the domino principle, or the devil. Think dollars. So it resides in details. Health insurance is details. Some can decipher it easier, and that's okay, but you can never assume. I'm being filmed, so I'm not really supposed to say what I'm getting ready to say, but you know, what's assume mean? It makes an ass out of you and me. Never assume, okay? Work to find the answers before you enroll in a health plan. So Act 1, we should care. Okay, health insurance. What is health insurance? Private insurance. That's probably where most of your parents have insurance, is through private insurance. Whether it's through the employer or individual where it's been purchased. How many people's parents get their insurance through their employer? 70% of Americans do. All right? That's called an ERISA plan. And then you've got all these wonderful little acronyms. HDHP, PPO, EPO, HMO, FFS, et cetera, et cetera, et cetera. That'll hurt your head if you keep thinking about what all of those acronyms mean. And then there's the public insurance, which is Medicaid, Medicare, military, U.S. government, Tricare, which is military, U.S. government health plans. That's where we stand in America today. So why is it important to people with diabetes? It's important because diabetes costs money. So this is a study that was done by the American Diabetes Association, and it shows that people with diabetes have 2 to 3 times the higher annual medical costs for a person with diabetes. Anybody in here want to argue that? You have friends?
2 to 3 times?
The study is 2 to 3 times. Now understand, they took the entire gambit of diabetes, not just type 1, the entire gambit of diabetes, okay? So it's 2.3 times. Money, money, money. What makes the world go round, okay? So why do these companies care? Because you are a paycheck. Each of you in this room that has diabetes is a paycheck. They make a lot of money on you. The average spend is $10,000 over a 3 to 4 year period. So you ever walked in a pharmacy or a grocery store and suddenly you've seen something about diabetes that's directed on one of these little flyers? Because you are money. You all, yes sir.
Is that why, like, when you go to the front of the pharmacy, they almost always have, like, a diabetes, like, specific, like, a shelf right there?
You're exactly right. Okay? Because you are money. Okay? There are studies that say this, but anecdotally, I'm just going to tell you that you all make more money for a pharmacy than any other disease out there. Okay? So, we're money. Anybody think we get treated like that? No. Okay, quiz number 1. The primary goal of health insurance is to A, B, C, or D. So how many people think it's A? B, C, or D? Smart group. The primary goal of health insurance is to make money and pay dividends. Health insurance companies are not benevolent associations. Even those that say they're no nonprofit, health insurance companies' job is to make a profit. Okay? Pharmaceuticals companies' job is to make a profit. I could switch back, but remember the slide? Money, money, money makes the world go around. So anybody that believes that a health insurance company is there to help you, you're right, but it's mostly to help them because their job is to make money. Anybody ever heard the term Obamacare? You heard the term Trumpcare? Okay. So what we've got are two kind of different ends of the spectrum. So under Obamacare, the government came out with essential health benefits. Now what that means is that there were certain things that every single health plan that was not Medicaid or Medicare, because that's government, every single health plan had to have in it. Okay? The little guy with the umbrella is basically saying that's what those are. Now, I will tell you, having been in that fight, we didn't get everything in there we wanted, but we got a whole lot in there that we needed. So the difference between the two pictures, simple. The umbrella of essential health benefits helps when it's raining. The other one doesn't do a thing. So people with diabetes were the very top beneficiaries under the Affordable Health Care Act, or Obamacare. President Obama called it Obamacare, so I can call it Obamacare, okay? But Affordable Health Care Act is what it's actually called. It stopped insurers from denying coverage for people with diabetes. It used to be that if you had diabetes, particularly if you were insulin dependent, whether it was type 1 or type 2, you could not get health insurance. Some of these people in the back of the room that are older than you can remember that, you know. They charged us a lot more for our coverages. The Affordable Health Care Act stopped that. They discriminated against people with diabetes. They let you stay on your parents' plan until you're 26. I will tell you that that helped when it was passed. It helped my son, who has type 1 diabetes, stay on my plan. Medicaid expansion, so it expanded Medicaid. Kentucky, where I'm from, where I live, was the #1 state that was helped in getting more people insured than any other state in America. It helped get people insured and gave subsidies to the exchanges. The exchanges are where you go of last resort. If you don't have employer coverage, if you can't go and buy it on the private market, you go to the exchanges. And depending upon your income, you got a credit. So that means that you didn't have to pay the full price. You might, depending on your income, only have to pay 50% or 75% or even 25%. So right now, the government, the current government that we have, is chipping away at all of these essential health benefits and all of these wonderful things that people with diabetes got. Some of them want to eliminate the pre-existing conditions coverage. Some of them want to roll back Medicaid expansion, and they do that in various ways. Some of your states, you might have experienced this. My state, my lovely governor, has tried to put in work requirements or volunteer requirements. Now, part of anybody been to Kentucky? Anybody ever been there? It's real rural. It's very rural. So many of the places up in Appalachia, they don't even have the internet. I drive up to where my family's from and I can't get cell phone service. My God, how do I live? I can't get cell phone service. So how in the world are they supposed to report electronically either their volunteer hours or their hours of working? It's ridiculous. And then they're going to allow skinny plans that don't have the essential health benefits. So your employer might be able to go and buy a small group plan that says, oh, you don't have to follow all these things. What's that mean for people with diabetes? And then high deductible plans, have I said don't enroll in them yet? Okay, all right. Just want to make sure you all were listening. Case in point, anybody remember when this happened? A couple of years ago? There were a number of us that took great umbrage to this gentleman and what he had to say. Okay? I really just can't even say, it just upsets me so bad I can't get.
And what was worse was like, then Jimmy Kimmel didn't even like defend the people with diabetes. He was like, you guys you're too sensitive. I was like, wow.
Well, never depend on somebody else to defend you, ever. Okay, right, Dan? Never depend on somebody else to help you. Okay, you ready? Here go. Another pop quiz. The most important gauge of your health insurance policy is premium cost, co-pays, deductibles, number of doctors available, cost of visits. There's no easy answer except to assess, analyze, and do the math. D? C? Yeah. Which one? D. All A, B, and C are important. D is basically all the above. Yes, ma'am.
It's incredibly hard to actually find, if you're looking like, well, is this thing covered? That recently I was trying to figure out how that would work, like last year when I thought I'd lose my health insurance. I called a nonprofit that specialized in helping people navigate the health insurance exchange. The health insurance folks that they were trying to ask the same questions to figure out what was covered and what wasn't, wouldn't even talk to them unless they gave them a name, and then they also told them that they couldn't tell them the answer. It's just really, really hard to find the information in order to assess and analyze and do the math.
You're exactly right. That's why you are a person with diabetes and you have to do the research.
But how?
We're going to talk about it. Okay. I've got 39 slides and you're on about 30, so we're on 19. We'll get there. Okay. All right. So planning your future. Thank you for the segue. Do not plan in a crisis. Do not plan when you've already have a problem and you're standing at the hospital emergency room or standing in the doctor's office, okay? Don't plan in a crisis. So, look at the policy benefits and details before enrolling. Call the health plan navigator, talk to HR, inventory your monthly costs and needs, do the math. Now you see the little red box down there? This is something I want everybody to write down. Affordable Insulin Project. I think it's affordableinsulinproject.org is the exact words, but Affordable Insulin Project. That is a program of DPACs that was developed with a grant by Eli Lilly. Many of you have met Jackie Giovanni that was here yesterday. She is the person that got DPAC that grant. So if you see her again today, thank her. It has information and worksheets that you can use when you pick your health plan. It gives you a template of how to do exactly what we're trying to do. Okay? It's online. There's actually even templates for employers. But for you as an individual, or if you're working with your parents when they're picking that plan, this gives a worksheet, easy to understand worksheet to look through, okay? So it's Affordable Insulin Project. Have anybody heard me say do the math? Have I said that? Okay, I just can't remember what I've said, so.
No high deductible plan?
No, well, you know, if you do the math, you'll figure out whether that, I won't have to say that. Okay, so what are the questions you should ask when you're looking at a health plan? Do I have to meet the deductible before my diabetes medications, supplies, and services are covered? Now, it used to be that everybody had a $25 or $10 copay on their drugs and supplies. And we didn't know what anything cost. We just knew it cost $25 or $10. Now, in these high deductible health plans, they are now part of your deductible and your copay. So suddenly, we are now forced to know what our drugs cost. Have any of you ever been involved in buying a car? Okay. Do you shop? Do you look at different options? Do you go to different dealerships? Do you ask questions about what it costs? Do you figure what your monthly costs are? Okay, we do that with buying an iPhone or an Android. We do that with buying bread or milk. If we know at this store over here that's less than a mile away, we can get bread and milk and our groceries for about $50 less than when we get them over here. Where do we go? If it's the same stuff, we go over here. Nobody does that with their health care. Nobody asks the doctor what something costs, because all we want is the medications to allow us to live and manage our disease, or the treatment to make us feel better or make our loved one feel better. Nobody asks costs. That's the problem in healthcare. We need to ask costs. There's a bill before Congress that says hospitals are going to have to post what things cost, and doctors are going to, okay, but it's up to us as individuals to make that question and ask. Can I fill my prescriptions, including insulin, every 90 days or every 30 days to save money? Anybody use mail order for drugs? Have you ever compared the mail order to going to a pharmacy?
I don't think so.
Compare it. I found out one of the drugs, I have type 2 diabetes. I'm on a drug called Ozempic, and I found out that I could get it at the Kroger, which is a grocery store, Kroger pharmacy, for like $50 every 90 days cheaper than using the mail order. And when I asked the mail order, they said, that's just the way it is. Great answer, I thought, wonderful answer. So don't assume anything in your health care. I think I heard some of you talking earlier today. It doesn't sound like any of you assume what a doctor tells you the first time is always the best answer, right? Okay? Never assume, okay? Never assume. Are my doctors, hospitals, and pharmacies in-network, or will I need to pay extra? Do you know what the difference between in-network and out-of-network is? Everybody understand that? Okay, all right. Do I need to see a generalist for diabetes care? Sometimes some plans say that they won't pay what an endocrinologist charges. There's a nationwide shortage of endocrinologists right now. In my plan, I see a PA. Okay, many of you may shaking your head, do the same thing, but then my plan won't pay for the PA unless the endocrinologist signs off on it. So I have to sit in her office for an extra 15 or 20 minutes until the endocrinologist gets free to come in and looks at the computer screen, says, hits the button, says, you're fine, bye. Okay, all right? What's it mean when the doctor says you're fine? What's it mean to you? I'll tell you what it means to me. I was doing great. I haven't had a A1C above 6 in 15 years. That sounds like somebody's in pretty good control. As a matter of fact, the highest A1C I've had in the last 15 years was a 5.8. The other day it was a 5.2. Okay? I had a heart attack in 2016 and almost died. With our disease, you're doing great until you're not. And it's up to us to make sure that the medical team we have is managing our disease the way it should. And it's up to us to make sure our health insurance is paying them to get the best advice we can get. What are my monthly premiums, copays, and deductibles? Will I be penalized for using a copay card or other assistance? Anybody ever used a copay card? Do you know what a copay card is? Corey.
Well, I know what a copay card, but my question is, could you explain what a task card is?
A what?
A TASC card?
TASC.
Yeah.
My family has one of those.
Yeah.
I've never heard of it.
It's basically like a certain amount of money that you put aside in your healthcare plan that, I don't know the specifics, but basically when we reach the limit on that is I think when we hit our deductible. And we utilize that card every time we go to the pharmacy. But it's kind of like putting money aside that you don't really.
Sounds like a copay, but does it count towards your deductible?
It does count towards your deductible.
It does, so it's not a copay card. So it's something specifically within a health plan that I frankly have not seen before.
Okay.
Okay, thank you for giving me something new to go research, Corey. I really appreciate that. I didn't have enough. I really appreciate that. Thank you very much.
I have another question.
Shoot.
I was wondering, so sometimes I go to my endo and I pay my copay, and then like a month or two later in the mail, I'll get the money that I paid for the copay back in a check from the hospital. Do you know why that might be?
I know that I would run, not walk to the bank and cash it. Okay? All right? You know, there's differences, okay? So, copays versus coinsurance, okay? Every plan has a deductible, all right? After you meet, copays sometimes are there excluding the deductible. So in other words, it depends on the plan. Sometimes a copay is always there. $100 emergency room copay. It doesn't matter whether you met your deductible and your coinsurance, $100 emergency room copay, okay? Always. Coinsurance means that you're paying a percentage and your health company is paying a percentage until you hit a threshold, okay? So the only thing I can tell you is that it was coinsurance, not copay, and then you had hit the threshold and the hospital didn't realize it, so they got paid 100%, so they sent you back the difference, okay? So you've got a deductible, which could be, and this one that I'm showing right here is $500, which is what most of you should have, $500, and then $1,000 per family. Which means that if you have a family of 3, each of you have a $500 deductible to meet, but then if any one of you hits 1,000, or 2 people hit their 500, then you have a family deductible of 1,000. Then your deductible, all you have after that is coinsurance. And then the coinsurance has an out-of-pocket. The out-of-pocket expense is $2,500 per person, or $5,000 per family in this plan that I'm showing you, okay? That means that once the entire family hits that $5,000 number, then coinsurance is 100%. The plan pays 100% of your bills. Unless you have a copay that says $25 for every vial of insulin, or $10 for every doctor visit, unless there's a copay in there, okay? So out-of-pocket means you're the highest cost you've got, okay? Deductibles means first dollar, and then you have a per person and $5,000 plan, okay? This is the kind of thing you're going to see when you look at health insurance, a document similar to this, okay? All right? It shows you services you need, and it talks about formularies. Anybody know what a formulary is? Anybody like formularies? You shouldn't. You should hate formularies, okay? If you take my presentation and play it backwards, it's like the Beatles' White Album, okay? It says formularies and PBMs are the devil, okay? All right? Formularies were devised by companies to determine preferred drugs. And now we have what's called exclusionary formularies, which means that this is the only drug they pay for. Or if there's an appeal, you have to pay the total out of pocket. It's ridiculous, okay? You've got generics, preferred, non-preferred, specialty drugs. Formularies were devised, I'm 100% certain, by an accountant in hell, okay? Because they really do not benefit us, okay? And you have to know the formulary. So every year when the health plans renew, you have to go online, pull up the formulary, and look for your drugs and make sure that they're on there at tier 1 so they get paid for. If they're on there at tier 4, you're going to pay a whole lot more. And then you have to go to your doctor and ask for appeal. Anybody ever had their insulin switched? Okay. Were you doing fine on the insulin that you were at? And you got switched. Did anybody ask why?
Yeah.
But who'd you ask?
My parents.
And who'd your parents ask? The doctor?
Company.
Did they ask the insurance company?
Yeah.
Good, Cassie. That's very good. Because that's who needs to be asked. The doctor throws her hands up. The average endocrinologist in a study in 2017 is 1,500 unpaid hours a year they spend doing appeals. Unpaid hours a year. If you had a job, this would mean that you would work 1,500 hours for no pay in a year. Anybody want to do that? Yes, ma'am.
So I recently switched insurance companies, and so my insurance company refused to cover Novolog, even though I've been on it for 10 years, and now I'm on Humalog. My doctor wrote an appeal after we called the insurance company, and my appeal got denied. So if you're saying every year you should check your formulary, does that mean every year I can send an appeal in to see if they will switch me over?
That's a great question. And can I get you to parking lot it till we get to that slide?
Sure.
Okay. Okay, so this is the math that I want you to do. Does this look familiar? Okay. Average cost, $1,300. Annual cost, $15,000. So if a high deductible health plan looks good because the premium is lower on a monthly basis, but that premium is not, for example, in this example, not $15,000 lower, you're buying the wrong plan. Now, if that premium is $20,000 lower, based on this example, you're going to save $5,000. But what's not on here? What happens if you get the flu? What happens if you have any other kind of, this is just showing diabetes. You got to factor in everything. You got to factor in the entire cost. Okay? That's why I say, what do I say, Corey? Never buy a high deductible health plan, right?
Do the math.
Okay. So, the moral of this story is knowledge, lists, and math will save dollars. With type 1 diabetes, basically with almost any chronic disease, but with type 1 diabetes, your best insurance option is more than likely not the plan with the lowest premium. Now, let me kind of talk about deductibles for just a second, okay? Everybody got car insurance? Or your parents have car insurance for you, or you have paying your own car insurance? Most of you probably own a car or have a car. Okay, you know what a deductible is on your car insurance? If you have a wreck, that's what you or your parents have to pay out of their pocket to get your car fixed, right? Okay. Most college students that I talk to don't have $1,000 laying around in a bank account. So what kind of deductible do they need in case somebody with no insurance hits their car and it has to be fixed? Low, right? That means you're paying higher premium, but it means that in case something happens, the money's available there to get your car fixed. And most of us use our cars to go to work, sometimes go to school, whatever. So we need that transportation. Many places don't have great public transportation like you have in big cities. So The same thing applies to health insurance, okay? If you're forced to pay for the first 3 months of the year, the list costs on insulin, most people, that means you're running up a credit card, or you got to have a bunch of money in the bank, or you look at the pharmacist when you walk in and you go, oh my God, $1,700, $900, whatever that price is huge. So that's the whole thing about deductibles on health insurance. It's no different, okay? Ask the questions and do the math. This applies for all policies and Medicare. It doesn't really apply for Medicaid. Everybody know the difference between Medicare and Medicaid? I don't see a lot of heads nodding. Medicaid is run by the state with a partnership with the federal government. It is for people who don't make enough money, are under the federal poverty threshold of money, and you can get your health insurance through Medicaid if you are under that. I got to tell you, a lot of times, college students that are not on their parents' plan for one reason or another, or are putting themselves through college, qualify for Medicaid, okay? So sometimes college students getting out of college and get a job that's not making enough money qualify for Medicaid. So it's something that you need to know what it is, and it's always been called low-income health insurance, okay? But low income does not mean destitute poor. So it may be something you or one of your friends may qualify for, okay, if you're not getting support from your parents. Don't waste money on high deductible health policies if you have other options, okay? Is that ingrained in you yet? I've said it, how many times? Okay, all right. Okay, you ready? Another quiz. Who do I trust? Well, you trust everybody. You trust your employer, you trust your doctor, you trust your parents, you trust your insurance company, but at the end of the day, who's affected by your disease? You are. Myself, but only when I do the math, okay? Okay, other math thoughts. Every benefit or service, someone's making money. Do you remember my little speech real quick? We are money makers, okay? We're money makers for pharmaceutical companies. We're money makers for doctors. We are money makers for hospitals. We are money makers for pharmacies. We are money makers. Careful. Anybody ever watch how they spend their money? You probably do it all the time, don't you? Okay? Not quite sure my daughter does, but they do it all the time. Prices vary regardless of category greatly. Shop around. Go ahead. I feel this burning question.
It's just that it's so untransparent and so hard to figure out how to shop around. Because nobody advertises the prices or anything.
And if they do, they're probably not true. Okay? It's probably a come on. Okay? So, what was one of the first things that you got taught about your disease?
Well, there would be a cure in 5 years.
Yeah. Okay. You have to manage it, correct? You, not your parents, not anybody else. It's a disease that you have to manage. Okay? It's not a lot of difference than playing sports. If you were to play a sport, it's up to you to do that. If no one, I hope no one in here has anybody else take tests for them, but no one goes and takes tests, it's up to you. Your disease is the same. It's up to you to check that, to look at that, to call, to go online, to do all those things to make sure you're getting the very best deal you can get in case something happens, all right? Okay, you ready? Your health plan or PBM, pharmacy benefit manager, and I'll explain that in a minute, have a financial incentive for each claim denial patient appeal, or decline prior authorization. True or false?
True.
True. Your health plan, PBM, and pharmacy make money on each prescription they process for you. True. Gosh, y'all are smart.
I had no idea.
Okay, so when a appeal is denied, you know, there was a gentleman in California who was the medical director of a major insurance company who under oath said that they denied every appeal the first time. Okay? They make, we figure they make $45 for every appeal. Now, insurance companies deny that, of course, but they make $45 every time they deny an appeal. So I have basically 9 words for you, Cassie, when you talk about appeals. Never give up, never give up, never give up. You ever heard the old adage of squeaky wheels get oiled? That's exactly what happens in appeals. You don't give up. I have an anecdote about, and this was 15 years ago, but when I was head of advocacy at the American Diabetes Association as a volunteer, and there was a lady whose daughter had type 1 diabetes and her insurance company would not pay for a pump. And she said, Stewart, what do I do? And I said, never give up, never give up, never give up. And she didn't. And she ended up getting to the president's office of the insurance company. And the president of the insurance company finally talked to her because she never gave up. And when he talked to her, he said, ma'am, I'm confused. What do you mean we don't cover pumps? I have a daughter with type 1 diabetes. They covered pumps the next week. Never give up, never give up, never give up. Okay, true or false? Good job. False. So here's where we talk about, in a study we found that a vial of analog insulin costs $90 less using GoodRx, InsideRx, and Blink Health than a co-insurance in the sample high deductible health plan. Okay, anybody ever heard of GoodRx, InsideRx, or Blink Health? Sarah, you have a question?
Yeah, well, I recently have been getting ads on like Hulu and all them about GoodRx. I'm like, you're definitely listening to my conversations and everything. I'll turn my phone off. But I was wondering, so when I was diagnosed, they're like, yeah, we'll just send your prescriptions to Rite Aid. It's the pharmacy closest to me where I was living. Now, where I live, there's like 3 CVS's really close by. I can walk to them. So, but then I was like, none of this is the right thing, but I'm like, oh, like, it's always been Rite Aid. I'll just stick to that because that's what I'm used to. So I would be really interested in knowing, like, should I call CVS and say how much would it cost if I'm there? And I know sometimes it's like when you enroll or, you know, start getting your prescriptions there, sometimes there's like a little, like, gift card or I don't know, just something because I'm going to be there so often. But is that something that you would suggest?
Yes.
Because it varies. So, like, call CVS and say, how much would this cost?
And the problem is CVS is going to look at you and say, we don't know.
Right, because that's what I was thinking.
Because you have to, they have to see your health insurance card
okay.
to figure out.
Okay.
Because do you think pharmacies set the price? Your health insurance company and PBM set the price.
So so it does matter which pharmacy you pick it up from?
Yeah.
Outside of the fact of in-network, out of network?
So I'm going into the store and giving them my card.
And saying
And
this.
they're going to do the math.
And saying, and you have to have, they have to know what your prescription is, okay? And then you're going to do the math. You're going to say, okay, what do I pay for this?
Okay.
Yeah.
So I want to preface this with sorry if I give away a part of your presentation, but I remember.
I've only got 8 more slides. We're in good shape.
I remember remember one of the things that I took away from the last time that you spoke that I heard that I literally will not forget is like ask the CVS when you go, what does it cost out of pocket? Like you can ask them that. They can't tell you. There's some law that says the pharmacy can't tell you if it's cheaper out.
Corey, thank you for that segue.
Oh. Okay, go ahead.
Corey, Dan, next time I come, Corey's going to be my assistant presentation. We'll have him work the slides, okay? All right. So, will the pharmacy charge the lowest price for insulin? What Corey was talking about is exactly right, okay? There's a couple things. Now, Congress just passed a thing called gag order, gag clause. A gag clause, what Corey was referring to, is a contract between a pharmacy benefit manager and a pharmacy that says you will not share a lower price on insulin or any other medication than what we tell you our person can pay. And my simple, you probably remember the example I used. After I had a heart attack, never had one before, it was a stimulating experience. They put me on 3 or 4 different drugs. And one of the drugs they put me on, it said, take twice a day. Now, I'm pretty smart. I went to college. I'm pretty smart, you know. So I was taking it twice a day, and I ran out of it in 15 days. I had a 30-day supply. I ran out in 15 days. I went back to the pharmacy and said, hey, y'all shorted me. They said, Mr. Perry, how much have you been taking? I said, here's what the bottle says. It says twice a day. They said, no, it says 15 mLs twice a day, and these are 30 ml pills, so you have to cut them in half. And I said, where on this thing does it say, cut this pill in half and take it twice a day? I said, you people ever heard of the KISS theory? Okay, keep it simple for the stupid. Yeah. And they said, well, you know, I said, okay. I said, well, look, I got to have the medication. I said, no wonder I've been feeling bad. My blood was so thin, vampires didn't speak to me in Halloween. So I said, okay. I said, I need the medication, so go ahead and give me another. Can you refill it? Your insurance company won't pay for it. I said, I understand that. You know, the good Lord blessed me with enough money that I can write a check if the insurance company won't pay for it. So that's fine. What's it going to cost? He said, $19. I said, what? I paid $45 for this bottle. And they said, well, that's your insurance company's price. Said the cash price is only $19. I said, why didn't you tell me that? They said, we can't. Gag clause. Ask.
I'm shook.
Ask. Now, Congress has passed a law that says they can't do this anymore, but it doesn't go into effect until 2020. So just hold and don't treat your diabetes for another year and you'll be fine, okay? 2020 is when it goes into effect. So, do the math. Make sure you're paying the lowest price. Ask the questions, okay?
Do you have to ask what is my out-of-pocket cost, and are they allowed to answer that?
You're allowed to ask, if I paid you cash and didn't use my insurance for this medication, what would I have to pay for it? Okay. Do you have a discount? Do you have a copay card? A copay card is what a manufacturer puts out that says you will not have to pay over $25 or $50 or whatever it is for this medication. Anybody ever seen a card like that? Mm-hmm. Now the problem is your insurance company now says that doesn't apply towards your deductible. Why? I mean, an insurance plan is supposed to pay, you have to pay a certain amount before they kick in. That's the way it's designed. Why should they care who pays it? If I want to write a check, Max, for your deductible, why is it any of their business? It's not. But that's the way health plans are working now and PBMs are working now. It is grossly unfair. Yes, Corey?
I just wanted to add, so another good example is Lancets. You can get them right on the shelf, but sometimes that price is actually lower than the price you pay if you would get it as a prescription. Yeah. So if you're paying what you think is a lot for your Lancets, you might want to just double check the aisle and see if it's cheaper in there.
Bingo. Bingo. Before my son went on a Dexcom G6 or G5, now he's on a G6, he was using finger sticks. And he said, Dad, I can't afford, my son is 34 years old. So he said, Dad, I can't afford these strips. So he went to Walmart and bought discount strips, but it means they didn't go against his deductible and his copay on his insurance, but when you do the math, he still saved money, a lot of money. So do the math, check the, yes?
I feel like, well, this might be a stupid question, I'm really sorry, and I feel like we were starting to...
No such thing as a stupid question, only a stupid answer.
Okay, wait and see. So I think this is just something I would probably just have to call the insurance company, but I think you were saying something about it doesn't matter how much the prescription is for, it should just be like a certain cost. So I'll just explain. So I'm on thyroid medication, and it's $15 a month. However, last time I got 3 months, and so it was $45, but my dad said it should have been $15 because it was one prescription that I picked up.
No, they're going to charge you they're going to, that's another little scam, okay?
Okay.
That they do. I agree with your dad. That's the way it used to be.
Right.
So now they figured out a way to save $30
Right.
because they charge you $15.
Right.
That was my point earlier about the mail order versus picking them up.
Right, yeah.
Sometimes it wasn't $45, it was $55. So if you'd just gone and got it every month, you just saved yourself $10.
Yeah.
Okay? That's what they do. They make you believe that mail order's cheaper. Sometimes it is.
Okay.
Most of the time, it's not unless you check it. Max.
I was going to say, one of the things with the mail order, I've never done this, but I've talked to people who have, and they've said it's been really good, but some people don't have good health insurance, and so they have to pay a lot for insulin.
Yeah.
And sometimes it's actually cheaper to order it from Canada.
Okay, so let me tell you the problems with that. Okay.
I thought there might be
All right.
some.
The United States of America has the best organization that watches out for us when it comes to prescriptions. It's called the FDA, Food and Drug Administration. Other countries have similar organizations, but not like the FDA. Now, I complain about them a lot because they don't approve things as quickly as I think they should. And, but they ensure that insulin is transported and handled the way it should be handled. And God forbid anybody in that process crosses them, because they will be out of business so fast they don't know what hit them. It's kind of like the local health departments that go into restaurants and check them to make sure there's no roaches or rats or any of that kind of stuff. You've seen those health department in your cities. So going to Canada is an option, but you don't know how that insulin has been transported.
Okay, so it's an issue.
I will tell you that there is a study that shows that they went to Mexico and got insulin, and they found out that 50% of that insulin vial had sugar water in it.
Yeah.
Okay? Now that's really good for someone with type 1 diabetes. Shoot them with sugar water, right? So when you go to a foreign country and pick up your medication, there's nothing to say that you're really getting it. Now the other problem is Christelle Marchand, who runs DPAC, was in Canada and bought some insulin, and they took her driver's license and they took her name and her address, and then they said, okay, here's your insulin, and you may not come back and buy it again in Canada without a prescription from a Canadian doctor. So Canada is starting to put limitations because in 2004, the Prime Minister of Canada gave an interview that said, we cannot fill the United States' need for prescriptions. There's not enough drugs here. So importation or going to foreign countries can be a solution, and it can also be the wrong solution. So I prefer not to screw with my disease, okay?
Is there a way to tell them?
No, not unless you happen to own a lab and can do the test.
But I know that recently there was a test about where they tested insulin in the United States from like various pharmacies, and none of them actually were the FDA standard, and there was so much variability, and that's why half the time we're not even using insulin that stays insulin.
Dan gave me a warning, but I didn't start on time, so I'm going to ignore his warning. Okay. All right. Okay. Insurance company is changing preferred insulin. Non-medical switching. Remember what I talked about earlier on that? Bad news. Shouldn't happen. Okay? Okay, so let's talk about what happens. No one should have to ration insulin. Okay? Ever. Never. Not in this country. So it's okay to ask for help. So each of these blocks talk about what you should do. Understand and maximize your coverage. That's what we've been talking about since I started. Ask for cash prices. Use retail discount programs. Enroll in copay cards, manufacturer discount potions. Check them at member warehouses, Costco's, Sam's Club. Find a community center. Talk to your employer about insulin costs and talk to your diabetes team about lower costs. Okay? We have NDVLC has a presentation we do on access to insulin that describes what's going on, and we can actually go and do it to employers. So if one of your parents has an employer that's not covering diabetes the way it should, we can have a conversation with them and see how it is, so make them understand what it is you need. Offense scores points, defense saves dollars. If you've ever played basketball or football or any soccer or anything else, offense scores points, the defense saves points, saves dollars. Know your rights. Appeal any no. Ask for an emergency appeals for anything diabetes related. If you ask for an emergency appeal, the law says they have 72 hours to respond. Push until you get a yes. Never say no, never give up. And it helps to make sure you've done the math first to show them. Winston Churchill, it's not enough we do our best, sometimes we must do what was required. Never give up, never give up, never give up, especially when you're going through hell. Never give up, okay? 10 steps for you to take right now. Do the math. Anybody heard me say that in my presentation? Okay. Never enroll in a high deductible health plan if you have any other option. Now, that's the codicil I put on it. If you don't have a choice, you don't have a choice. But never enroll in a high deductible health plan. Visit the Affordable Insulin Project. Okay? Never accept no as a coverage decision, Cassie. Never give up, never give up, never give up. How many in here register to vote? Congratulations. That's the first time I've given this presentation that everybody raises their hand, okay? Register to vote and exercise your right to vote. Sign up for diabetespact.org. Conduct your research, get involved. Okay. Ladies and gentlemen, you have a responsibility to yourself, to your family, and to other people with diabetes to stand up and be involved. It's not easy. Sometimes it's hard, and it takes time. But as a person who needs to control their own disease, as a person who cares about others, you wouldn't be here if you didn't care about other people, okay? You've got to stand up and advocate for your rights and the rights of other people who either can't or won't stand up for themselves. So get involved. If you sign up for these organizations as an advocate, they send you an email, or you can go on an app. DPAC actually has an app that I check. I'm supposed to check every day, but I check every 3 or 4 days. That gives you opportunities to go on and advocate for things that are important for people with diabetes. It's not just research funding. Finding a cure is very important, but it's not just research funding. There's lots of other things that we get involved in that we need to. Attend political events, run for office, and don't let the perfect be the enemy of good. Heard that before? Don't let the perfect be the enemy of good. Go to events, tell politicians your story. Sometimes it's scary, but I think it's something you can do. Tell other people your story. Get your parents involved, get your siblings involved, get your friends involved. Ask them to stand up for you. That's what this is about. I've been doing that for 30-some years, and I feel like I've made a difference. Sometimes I'm doing it with Tina Roth in the back of the room, who's with me when we're standing up. And sometimes we feel like we've made a difference, right, Tina? Don't let one pushback discourage you. Stand up for your rights. Stand up for what you need to do. You all have asked questions pretty much through the whole presentation. Okay? So does anybody have a burning question that they really need to ask before Dan gets the hook and hooks me out of here? Yes, ma'am.
I don't think you ever answered the question of how to do the research, to do the math.
You've got to go in to every resource that you have.
So the fight never give up applies to this as well?
Yes, ma'am. Okay? You've got to go, if the person you call doesn't give you the answer, go above their head or call back. Let me tell you, the one thing I've learned with insurance companies after representing them for over 40 years is the first time I call somebody and get somebody on the phone, when I call back and get somebody different, I'll get a different answer. Okay? Never give up, never give up, never give up. Advocate for yourself. Get somebody else to come in and help you. Okay? You all are obviously, because of your age, you're experts on the internet. And you know, everything on the internet's true, right? Right? So that's one way, okay? But get the documents, read them, ask questions, do it again. If they tell you no, Cassie, you go back and say, no is not an option. Let's try again. Okay? And you make them sick of hearing from you. Make them to where when your name comes up on the caller ID, you have to use somebody else's cell phone because they're not going to answer your phone. Okay? Never give up, never give up, never give up. Ladies and gentlemen, thank you very much for your attention. I appreciate it. And as an old diabetes advocate, it is thrilled to see people like yourself come in and be as attentive and caring about other people with diabetes.